And welcome back to Noon Edition. Candace Roberts with the Allen County Health Department. She is their Reproductive Health and Wellness Coordinator. That's a mouthful.
Yes, it is.
So I'm going to assume one of your big responsibilities is trying to educate the younger population, because we just don't want all of these pregnancies, accidental or whatever, happening out there.
Correct.
So you've brought in a lot of stuff here to kind of show us. So I guess you've got more than one plan.
Yes, so our nurse practitioner will provide multiple different methods of birth control. You can start with the pill, which is something you have to take every day. Sometimes teenagers and even young adults, they don't remember to take pills every day. So something long-term as far as an Nexplanon, which is an arm implant, or an IUD, can last anywhere up to 10 years at this point. That gets them through high school, college, you know, let them get their lives together before they decide to have a family.
Boy, things have changed, because I think when I was in high school, the pill was kind of the only thing that you really even heard about. So things have definitely changed in the last 45 years.
Oh, absolutely. And the pill now is not as effective as the long-term birth control options as far as the IUDs and implants.
Now, we hear a lot about the morning after pill. Is that something that you distribute as well?
So we do have it. Depending on the patient, it can be distributed.
Okay. Now, what ages do you guys kind of get involved? Whenever the parents want to?
So no, we actually accept any child 13 or over. They do not need parents' consent to come in. They can be a confidential patient.
Okay. So what about schools? Now, are you allowed to go into the schools? And if so, how do you reach into the...
So I've gone to a couple different schools to talk to their education and their health classes. Usually the school nurse or the health teacher will contact me and have me come talk to their students.
All right, so it's good that we're able to get a hold of this situation as soon as we possibly can. What's one of the most alarming things you see with maybe not just Allen County, but just our population in general?
I think it's just a compliance issue. Patients, you know, people forget to take their medicine, they get busy, they forget. It's just, we got to keep them regular. And
now, is this all funded with county funds, or how are you guys?
So we will bill insurance if the patient does have insurance. We also will help them apply for a Medicaid application that can also help cover their.
Great. So you guys have a lot of options. Now, you talked about something on their arm. How's that work?
So yes, it's this little Nexplanon. This is actually the size of it, and it goes in the little fat pad here on your arm, and it stays in for 3 years at a time.
Oh, wow. So the medication is in there.
Correct.
And it just distributes itself as needed.
Yep, on a daily regimen.
Wow. I'm a guy, I didn't even know that was available out there. So tell us about some of these other things that you brought in today.
So this one is the Depo-Provera injection. This is birth control coverage for 12 weeks at a time. This is a NuvaRing. This is a vaginal insert that can be inserted for 3 to 4 weeks at a time.
Now, what does that do exactly?
So it's birth control. It's coated with a medication that distributes on a daily basis.
Okay.
So this is good for, you know, summers. You don't have to worry about having your period and spotting or anything like that. And then the pills, of course, which is something you have to take every day. And then the IUDs, which, as you can see, can last anywhere from 3 to 10 years. Okay,
so you've got a whole bunch of different plans, 10, 8, 5, and 3 years.
Yes.
What's the difference, I guess, in those, other than how they work?
So the arm implant, the reason for the 3 years is just the medication that's in it. The Paragard at the end is a copper IUD. It doesn't have as many hormones compared to the other ones.
Okay, so I guess my final question for you is, are you seeing an advantage right now to what you guys are trying to do? Are you seeing the teen pregnancies go down?
I think with people that are like involved with sports, taking a birth control every day is not a valuable asset. So something more long-term that they don't have to worry about. Even the arm implant, you know, your parents aren't going to see it if it's not something you're comfortable talking with them, or they don't support your decision to be on birth control.
Okay. Candace Roberts from the Health Department here in Allen County, and we'll be back as Holly has medical coming up next.